Unfortunately, the answer is yes. So we looked at data from 1995 to 2015, and we found that over the course of that 10 years, 1 million lives were lost to drug, alcohol, or suicide. Recent data that we released yesterday looked at 2015 to 2016 and saw an 11% increase, which means that our 10-year projections moving forward, we would expect that we would see a 100% increase in the number of lives lost to drug, alcohol, and suicide. That's 2 million people, 2 million lives lost. We're seeing a spike in drug overdose deaths, and a lot of that is probably in response to the opioid epidemic and what we as a society are trying to do to control the opioid prescriptions that are out there on the street. 1 in 4 individuals are going to have some type of mental health need in their lifetime. I typically say half the room because if you look at some data, 46% are going to have a mental health or substance use need in their lifetime. The thing that should terrify us about this is that most of those individuals don't get treatment. And even more concerning to me is that we don't identify the folks that actually have need. So for substance use, we know that 1 in 10 are going to get adequate treatment. And for mental health, we know 4 in 9. So where we identify mental health and substance use is where we should treat. But our healthcare system has fragmented it so pervasively that it makes it difficult for people to actually get adequate identifying care or be identified and then get care for that. We believe in our report that one of the things that we're going to have to do is to be more proactive and go upstream. We're going to have to think about how can we create more resilient communities and have people, we as individuals, that are more resilient ourselves. So we define it in multiple ways in the report, but we really highlight the need to improve our mental health system so that when people have an initial need, they get care. That's one way to establish resiliency. It's one way for us to recover quickly from what's ailing us. We talk about really addressing pain in the variety of ways that people present with pain. So if you want to establish resilience and you want to recover from something that you've gone through, what would be better than an evidence-based team, an approach that allows you to more comprehensively address your pain? And we give multiple examples of that. If you look at the 1-year snapshot, which we just discussed, you'll find that there are some states that have decreased the number of deaths, but we have to look at it in the context here, and that's over the 10-year time frame. And 1 year is a snapshot. We might have done something, but we can't attribute what we did to a particular program. We actually need to think a little bit bigger around mental health. The thing that I think should be highlighted from these data is that we can actually prevent these deaths from occurring. So yes, they are pretty dire, and they're kind of a flag, a siren for us to do something. We can prevent those deaths. What is it we as a community, we as a group are going to do about it? Wellbeing Trust is a national foundation committed to advancing the mental, social, and spiritual health of the nation. We do so by investing in clinical transformation, community transformation, policy and advocacy, social engagement, and measurement and data systems.